the way it works. You want to make 2 of those.
Okay.
Just set it there. Okay. Now I'm going to turn everything, and then once we get done with that, we're going to take our garbage circulator. I grab my garbage.
Yes, sir.
So we're going to hand that off to our circulator, and I'm going to turn this back around because we are about to start the procedure.
Hold on.
All right. So if you guys want to come up and take a picture, go ahead.
I have a question. Does that have to be there?
What?
On top?
Yes.
Oh, it's
And the
covered.
reason I have you guys put that there, because if you leave it over there, you'll forget to put it up when it's time to put it up.
Oh, okay.
And that just points off if you forget to put the light handle up.
Oh.
So I have you guys put it right
That's
there,
important, light
so
handle.
you'll know before you grab any instruments, you need to put that
Put
light
that.
handle up.
And which
Okay.
scissors did you grab again?
Straight males. I'll
Straight
give you
ma-
guys all that once we get into the procedure.
Okay.
Oh, the light.
Yes.
That makes sense. Yeah.
Okay, we good?
Yeah.
All right. Now we're going to gown and glove the surgeon. As soon as my surgeon comes in.
Unlike most surgeons, she's busy doing something else.
I'm scrubbing out.
Take your notes.
I'm scrubbing out.
Check it on the next patient.
All right, when your surgeon comes over, same thing, like you dry your hands, you're gonna give the doctor the towel in that same instant. Before that,
Because you're in the corner.
well, I'm speaking.
Okay, no, I
Yeah,
actually did
that's-
that. I actually did that for a reason, you guys. If you linger back in that corner, doctor will pin you in. You don't want that, okay? So come out to meet them. Don't be hesitant. Where you are is where they will come to. Okay? So we actually do that on purpose.
And notice too, I gotta watch out where my table is also, cause I don't wanna be close to the table. Now, open the towel, tuck your hands underneath, just like we scrub. Right hand first, always right hand first.
Maybe you can do
Never throw things in the
Oh.
oven.
All right. Now, when you're gowning someone else, when you gown yourself, it's smiley face to you. When you're gowning someone else, it's smiley face to them. Okay? So you're gonna grab the corners, this gown is folded, jacked up, but you grab the corners and you're gonna drop it like so.
If you can't find the corners, anywhere along the neckline will
Yes.
do.
Oh,
And then slide your hands out
All the
to
way
the
to the
corner.
okay.
Now, again, I'm going to tuck my hands underneath so I don't touch.
Okay. Can you pull back so we can show
Yeah,
them?
yeah.
Okay. You see how easy that happened?
Mm-hmm.
Let me put it in some so you can't see it.
Yeah. You see how now you can't see the armholes because he's not at the corners?
Can you turn around so I can see how your hands
Here,
are
yeah.
tucked?
Yes. So basically,
That's a good
I
idea.
just do this.
Touch the corners between your pointer and happy finger
Thank you.
And
and cuff.
okay.
Well, is that how you tell people you're happy?
When you go up, you don't want to go all the way up here on your surgeon because if they move their head, they're going to contaminate you. You want to come up to about right here and then let the gown drop. And then your circulator will come over and tie your surgeon up. This
Shoulders only.
I was about to say, yeah, this surgeon don't like to be tied up. Next, you're going to grab your gloves.
I didn't say that.
You just want the top.
I said not in class.
All right,
Yes,
so
please.
you're going to open up your glove, right glove first, always.
Over the table.
Yep, over the table. You're going to have your thumb,
Can you guys all see?
Yeah.
I feel like I'm right in the way for
thumb
this part.
towards your doctor. Okay?
Oh, okay.
This thumb.
The
Towards your
writing
doctor,
is
or the
also-
writing, either way. Thumb or writing towards your doctor. Now, this is just like rubber bands. If you have a whole bunch of rubber bands, it's hard to pull them apart. If you have one, it's a lot easier. So with your gloves, you don't want to come way down here and try to open them, because that's hard. What you're going to do is grab the very lip. Notice she didn't have to turn her hand. she didn't have to turn her body. It needs to be so they put their hands right in, and some of them go in quick.
A lot of times when doctors getting gowned and gloved, they're communicating with the circulator, they're communicating with anesthesia about the patient. Gowning and gloving isn't their focus. That's something that's kind of happening to them as they're sharing. They might even be talking to you. They shouldn't ever have to watch how they're doing it. And let me tell you, you give them their gloves sideways and they jam their fingers, how happy you think they're going to be for the rest of the case?
Not happy.
How many of you ever jammed a finger?
Yeah.
And that's your money makers.
Yeah.
You're going to be happy?
Oh.
That tech is now not your favorite. Okay.
Okay, and Jean just brought up a good point also. You want to be at waist level. You don't want to come up here and try, because the doc's going to have to do all this. Okay? And if you have shorter surgeons, you don't want to be right in their face. Because they're already mad to short. And I'm going to say that because I'm short too, compared to some of the doctors I work with. So,
For those of you who are taller, we're not joking about that.
Yeah.
You guys, especially you tall people, you already know about little man syndrome. And we say little man, but it's not just men.
A bunch of haters.
It's all the little people. Well, that's because little people are mean and they will climb you and eat your face. We know this.
I didn't
Can
know.
I see that glove portion again?
second glove, okay? This time, the doc sometimes helps. So you can come up, hook it on their fingers. Notice, my thumbs are out the whole time. Don't bring your thumbs in. Thumbs out when we're gloving the doctor.
Your thumbs either have to be under their glove cuff or pointed out and away. You can't be doing this because if I'm talking to you and I reach and your hand's not protected and I touch you, now we're both contaminated.
Yeah.
Okay? So one of us needs to be paying attention. And it's not going to be the doctor because they're still prepping the room for this patient or the next patient. They could be updating on our last patient who maybe is not doing well. There's all kinds of things. Oh, there's a case in the emergency room pending. I just want to give you guys a heads up. We might be bumping our next case. All kinds of information is being shared in the operating room all the time.
Okay? Next, we want to ask the doctor, can we spin? We don't reach for the tag,
Where's the tag hanging?
and if someone's
In the
doing
crotch
this,
area.
you know what I mean?
Should you be
Exactly.
reaching there on anyone ever in a work environment? No.
So-
Do not grab at people's crotches. It's rude.
Please pay attention to how Kasia does this, because this seems to be an issue for everybody. When you go to do your gown card, it is,
And it doesn't matter if he's sterile or if I'm spinning with the circulator because I'm the scrubbing in by myself. This is always the exact same process. What hand is this?
You're right.
Right.
Hand is this?
Left.
Left.
So I'm going to take,
You're
The
left.
left.
I'm going to grab this tie. I'm going to pull it out. Pull with the left.
Yeah, with the right.
Present
Present
with the right.
okay, now, if you're the scrub tech and you're already down, you want the other string that's in here in the card that she's gonna spin with, you wanna hold on to that. So that if the doc spins too fast, it won't just pull it out and fall down.
Some of our doctors are secretly prima ballerinas in their dreams.
So just make sure you hold that side of the tie. If you are not sterile and you are the circulator, you should not grab above this line. You should be on the blue only.
There's a picture. Notice in the picture, the fingers are ungloved. For your camera. If you have ungloved fingers,
Blue. Okay.
And I think I gotta drink that wrong. The butt drink first, then okay.
I heard that, but
All right,
The surgeon always ties themselves.
we all tie ourselves. No
The
one else-
bow?
Yeah. When
that would be a little too intimate.
Yeah, we all tie our own together. Once we spin, yeah, we all tie our own.
About a drop card.
No, we will talk about drop cards later. If
spinning them.
the tag falls, the card falls, don't touch it. Because where would it be hanging?
Below you.
Low.
That's right.
Right
Okay.
behind you.
Should you be reaching back
No.
there? Should you be reaching back there on anybody else? No. We'll deal with that later. Let's just, today it all went perfectly.
Okay.
Alright. Butt drape.
So the butt drape is supposed to be on top of the towels,
Yes.
not below. Okay.
Yes.
Circulator.
Oh, yes. Alright, so this right here, it says left hand,
Please prep our
right hand.
patient.
Okay?
And then I'll take it up about a 6-8 inches.
Left hand, right hand.
Okay. Sorry, I don't mean to be so.
Now,
sorry about
once so it tells you how to pick it up, tells you where to put your right hand, where to put your left hand. So you go ahead and put your hands in, and what we're going to do, you don't want this to go past where your gloves are. So if your gloves are down to your wrist, you can only have this up to your wrist, okay? Once you get it like this, you wanna close it up so that you don't run into anybody and contaminate. So you're gonna come over here, you're gonna grab this part and push all this out. Like so, okay? You grab the hands from me, Jimmy. A little bit more.
Sorry,
Then
guys.
you're gonna put this under. Notice, I don't wanna touch the patient with my gloves, the hips or anything. If I do, it's contaminated, okay? So once I get that under, hands out, and then ask my circulator, could they put that in the bucket for me?
Certainly.
I have a question. Would the circulator have gloves on? Like touching the
That
patient's
depends on
arm?
how old they are.
Yeah.
Does it always slide that easy underneath the butt without like?
So when we test, I actually hop up on the patient and give weight, so it'll be
Oh.
like a real patient. Cause sometimes.
What do you mean?
Their head. Oh, the
I'll
weight.
lean over like this while you guys are putting that in there, so you can get the
Oh,
actual
and when
weight.
y'all start
Okay.
putting your patient info up and you put up 50 keys, we laugh at you.
You want that?
How much does a 50 kilo patient weigh?
100.
How many patients you think we get in the OR weigh 100 pounds?
One.
How many patients you think we get weigh 75 keys? Once in a blue moon.
Okay.
Try 108 keys. That's more our average patients.
Same thing with your patient drapes. You wanna come, once you get them in your hand, you wanna come over, make sure you watch out for the, pole.
This is a thigh towel or a butterfly towel because it goes around the thigh to show the hoo.
Oh, I dropped that. So, I just dropped this side of the towel. Rather did that. So, because I dropped this side of the towel, when it swung, I don't know if it hit anything or not. So what we'll do, we'll drop that,
Oh.
grab a new one, because we're not sure if it hit. We're not sure if it hit the, hit anything.
So those towels on that side of the table are for extra.
Yes,
Okay, I want the fold
away from you.
towards me.
So it's away from you.
Oh, towards the center.
Towards me because this is going to be the belly towel for me and I want it fold down when I place it.
Okay.
Okay, so now I have squared off and I have just the vagina.
Sorry, Keisha.
Just
I have a question.
me and the vagina.
Yes.
So when we're putting the drape under them, there's always someone helping, moving the hands.
No.
The-
Their hands, this mannequin is in the way. Their
Yeah.
hands wouldn't be in the
Oh,
way.
Okay.
Yeah, there's certain positioning things we can't do with the mannequin because they don't move right.
Okay, all right, thank you.
They would already have the hands out of the way.
We're being timed for that as well, right?
And I
Just
want
until you put, from the time you touch your first glove to the time you put the doctor's second glove on, your
Okay.
time from that point to that point.
Thank you.
and understand. Do you guys see? Did you see where his face was when he was putting that drape in there?
Yeah, El Fresco situation.
Okay.
No, seriously.
No,
Seriously.
you guys, this is no joke. You are up in people's shit, okay? Their vagina, your face. Their penis, your face. I don't care who you are. That's your relationship now.